Welcome back to the Health Policy Doc, where healthcare reform, the latest in health policy, and the politics of healthcare are examined. I'm Tom Clear, an author and health policy professional. Thank you for joining us today as we tackle the ever-changing healthcare landscape. The Health Policy Doc focuses on healthcare reform and a variety of related topics. Today, we are going to examine the healthcare systems around the world and the response to the coronavirus COVID-19 pandemic. Here at the Health Policy Doc, we tackle conversations that center around the healthcare systems. At a high level, today's discussion will look at healthcare systems that are divided into 5 categories. Those categories are: first, countries with a universal government-funded health system, also known as a single-payer system. 2, countries with a universal public health insurance system. 3, countries with a universal public-private health insurance system. 4, countries with a universal private health insurance system. And 5, countries that do not have a universal health insurance system. First, let's look at countries with a universal government-funded health system. In this system, government-funded health care is available to all citizens regardless of their income or employment status. This system is also known as a single-payer healthcare system. Examples of this type of system can be found in Canada, Brazil, Italy, Spain, the United Kingdom, Norway, Sweden, and many other countries around the world. The next system is where countries have a universal public insurance system. In these countries, workers have social insurance. It is paid for through a combination of withholding from a worker's wages, which is divided between the employee and the employer. People who do not work may be able to register as unemployed and receive coverage. Others may be ineligible for coverage. Examples of this type of system include Belgium, France, South Korea, Russia, Iran, and many other countries around the world. Next, we look at countries with universal public-private insurance systems. In this system, some people receive health care primarily through private insurance, while other people who are ineligible for it receive it from the government. Examples of this type of system include Germany, Mexico, Turkey, Peru, and many other countries around the world. The fourth system we will look at is where countries have universal private health insurance system. In this system, people receive health care via mandatory private insurance. Usually it's subsidized by the government for low-income citizens. Examples of this type of system include Israel, the Netherlands, Switzerland, and some other countries around the world. The fifth system we will look at is where countries do not have universal health insurance. In this system, some citizens have private health insurance, some are eligible for subsidized public health insurance, while some are not insured at all. Examples of this type of system include the United States, India, Egypt, the United Arab Emirates, and many other countries around the world. In looking at these various types of healthcare systems, we are going to examine the testing rates and death rates for COVID-19 by the type of healthcare system. Now, there are several weaknesses to this type of analysis, so it should be received more from a conversational purpose. The testing and death rates were not available for many countries, so more comprehensive data across many more countries would really be needed to draw reliable conclusions. Let's look at testing rates first. Testing rates have consumed the early months of the pandemic, on which countries, states, counties have tested a lot of people, and others haven't tested nearly as many. And it's sort of been an ongoing conversation and controversy around the world, really, in terms of how many people should be tested, what should be the goal, and really trying to get as many people tested as possible. If we compare testing rates between the 5 different types of systems, it shows that the single-payer system has the highest rate of testing among those countries' populations. So, for example, the single-payer system has tested 2.99% of the population in a particular country. The universal public insurance system comes in at 2.54%. The universal private insurance systems, 2.5%. Universal public private insurance, sort of that hybrid, 1.66%. And systems where there's no universal coverage, 1.4% of the population has been tested. So clearly, the single payer system is far ahead of other systems in terms of testing the most people within their countries. So countries like the United Kingdom, Spain, Italy have all accomplished the highest rate of testing. On the other side of the coin, countries with no universal coverage, like the United States and India, have had lower rates of testing throughout the population. Now, as mentioned before, the sample size was very small for some of these categories, and there were countries who performed better than average even within a category. But based on averages, the limited data does suggest that single payer and other stronger universal health coverage systems have been able to test more of their population. I will add one note about the United States. It did perform close to the average of the single payer countries, but still quite a bit less than many of them. If we compare death rates between the 5 different health systems, it shows that systems that do not have universal health coverage have the lowest death rates. So, using the same categories, the single-payer system has experienced a death rate for their countries on average of 10.85%. The universal public insurance countries have experienced a death rate among their population of 8.16%. Universal private insurance has come in at 9.43%. Universal public private insurance at 5.72%. And countries with no universal health insurance have had experienced death rates of 4.69% of their population. So the lowest death rate is found in systems that do not guarantee universal health coverage, with the highest death rate found in the single-payer and universal public insurance systems. Another interesting takeaway from this limited data set is that systems that rely on private insurance as part of their system also had a lower death rate than systems that were entirely government-delivered universal systems. So what does this all mean? It really means we need to study it a lot more. Perhaps there are other co-occurring variables that contributed to the findings that this study identified, whereby systems that did not have universal health coverage actually had lower death rates compared to single-payer and universal health systems. Perhaps other factors like a country's public health system is really a better criteria to distinguish various countries' response to COVID-19. Or maybe there's an urban versus rural nature to the countries, or cultural traditions that might have correlation with better variables to analyze the differences. So really more study needs to be undertaken along these lines. Well, I want to thank you for making the Health Policy Doc a part of your day. The Health Policy Doc is here to study what needs to be done so that everyone can have health coverage. One of the objectives is to identify what works well, what does not work, what can be improved and what needs to be changed, and what really needs to be done to deliver the best health care to everyone. Please tune in next time as we tackle another facet of healthcare and health policy. Thank you. If you have any comments about today's episode, or any other episodes of the Health Policy Doc, or if you'd like to leave ideas for future topics, please email thehealthpolicydocpodcast@gmail.com. Thank you.